Fein, and I hope I get all of this correct. Dr. Fein is a general internist who has been at the forefront in promoting healthcare reform and national health insurance. He is a professor of clinical medicine and clinical public health in the Department of Health at the Weill Medical College of Cornell University. Along with being elected to the board of the American Health Association, he is the current president of the Physicians for National Health Program, a national organization that now boasts approximately 16,000 members. After much protest from single-payer advocates about being left out of President Obama's stakeholders conference in Washington, Dr. Fein was asked to attend, albeit at the last minute, but attend he did. He has toured our country educating people, and we in New Jersey are now fortunate to have him here with us today. I'd like to present Dr. Oliver Fein.
Well, thank you, Paula, and I could talk some about what's happening in Washington. But I thought what I would do first is really talk about why we should be in favor of a single-payer program for the United States. And so I'm going to do that, and then certainly answer questions. I have some comments on Senator Lautenberg's approach and so forth, and we can talk more about that. But I thought the question we'd like to answer is, national health insurance for the United States, has its time come? And I like to point out that I have no commercial relationships that are relevant to this presentation. What I'm going to do is talk in four areas this morning. First, a little bit of a history of health insurance in the United States. Then turn and talk a little bit about the economics of healthcare, what I call macroeconomics, where we spend our money and where we raise it in healthcare. Don't turn the lights out too much, everyone will fall asleep. Then talk about the failure of our for-profit private health insurance system that really dominates in the United States. And this will lead me to talk about national health insurance, single-payer national health insurance, its principles and possibilities. So let's talk about the history of health insurance in the United States. And I think there are four fundamental periods. The first of those is the period before 1936, when frankly there was no real organized health insurance in the United States. So how did people pay when they went to the doctor in this pre-health insurance period? Do you have any idea?
They opened their wallets.
Oh, they paid what they call OOP, out of pocket. Right, correct. And in addition,
Bartered.
they bartered for care. People brought an apple pie to the doctor, or they brought a chicken to the doctor, right? This was the time, frankly, when we did not spend a lot of our gross domestic product on healthcare, just 1%. We're now spending over 16%, right? And, as you said, doctors were paid for out of pocket and by bartering. But interestingly, when it got to hospitals, hospitals didn't want those chickens. So how did people pay for hospital care in this period?
They stayed home.
Well, there probably was a lot of people that stayed home, but hospitals existed. How did they collect money?
I have no idea. Cash or charity?
Aha! One of them clearly was cash, absolutely correct. But charity was extremely important. That's why you had, in the city of New York, for instance, the Presbyterian Hospital for Protestant patients. And why out here in New Jersey you had Holy Name Hospital for Catholic patients. and, even Mount Sinai and Beth Israel Hospital. So that there was a lot of charity care in this period. In addition, we had public hospitals, and in the city of New York, it's really interesting to realize we had twice as many public hospitals, 22, in this period, than we have now, just 11. So what happened in 1936 that began to change this landscape? Anyone have an idea?
Yeah, Senator Wagner introduced the Social Security bill.
Aha! In 1935, FDR and Senator Wagner actually got Social Security passed. Interestingly, FDR never really advocated for a national health insurance program. I think he knew it would be good to have, but he was very worried about us doctors, who were very vehemently opposed to any kind of national health insurance. The interesting thing about 1936, it's the date actually that Blue Cross was founded. Okay? And that ushered in this period of what I call private employment-based health insurance, and the second period of health insurance reform in the United States, 1936 to 65. The other thing that came in shortly after Blue Cross was BS. What was it? Blue Shield. Absolutely correct. 1946 is when Blue Shield came about. What's the difference between Blue Cross and Blue Shield? Blue Cross was hospitals only. Blue Shield was doctors and outpatient laboratory tests and things of that sort. And essentially these two companies were nonprofit, and in your state remain nonprofit to the present and really should stay nonprofit. It was 2003 that Empire in the state of New York converted to being for-profit. Now, what happens next in this period is that we enter into World War II, 1941. Wages are stabilized, right? What that means is that they're frozen. Unions cannot bargain for wages, right? But they can bargain for fringe benefits. And the two fringe benefits that unions wanted in this period were
healthcare and vacations.
healthcare and pensions, probably the more crucial, right? And it's this, what I call accident of history, that actually marries health insurance to employment. Just think of it. It's pretty unusual in this country when you lose your job, or by the way, when you graduate from college, you will lose your health insurance. There is no entitlement to it, right? And the reason this became even more linked to employment was that the IRS came along. You all know what the IRS is, I assume. And it ruled that if the employer contributes to the purchase of a health insurance premium for his or her employees, then the employer can deduct that from their taxes. Okay? A major development, actually. And what we find in this period is that commercial life insurance companies began to get into the offering of health insurance. So that you've got Prudential, Aetna, other companies like that that actually began to offer health insurance. But what happened in 1936 that began to change this landscape? Well, I'm sorry, not 36, 1965. Yes, we were in the midst of the Depression in 36, but not in 65. What happened in 65?
Medicare.
Aha! Medicare and Medicaid were passed, right? Limited forms of government-sponsored health insurance, right? Medicare limited to those over 65 in that year, Turns out it was expanded to people with disabilities and end-stage renal disease in 1972, and Medicaid fundamentally limited to the poor, and the U.S. remains, amazingly, one of the only industrialized nations in the world that does not have universal access to health care. And then in 1997, and that date is totally arbitrary, I picked it because it's the date that